to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. We're going to start with the review and approval of minutes. The last minutes that we don't have minutes for February, but we do have minutes for December. Did anybody have a chance to look those over and have any revisions at all?
None. No revisions.
No revisions? Okay, great. Motion to approve the December minutes?
Aye. Approve.
I second that.
Second. Thank you. Minutes with no revisions for December approved. Okay, organizational issues and important health dates. So since we weren't able to meet during March, I'm going to cover important health dates for both March and April. So March was National Nutrition Month, National Kidney Month, and Colorectal Cancer Awareness Month. Key weeks include National Sleep Awareness Week, which was the week of March 8th to 14th, and National Poison Prevention Week, which was week of March 15th to the 21st. March was also Brain Injury Awareness Month, Autoimmune Awareness Month, Endometriosis Awareness Month, Multiple Sclerosis Awareness Month, Gambling Problem Awareness Month, and National Women's History Month. That covers important health dates for March. And for April, it was World Health Day, April 7th, National Public Health Week, April 6th to 12th, and World Immunization Week, April 24th, or that's not, next week, is April 24th to 30th. April is also Stress Awareness Month, Alcohol Awareness Month, Minority Health Month, and Autism Acceptance Month. So, does anybody have any organizational issues or health dates to add?
I would just add to that about the Wellness Week at the Willows this week, which I'm not sure people are aware of. I think it started yesterday. It looks like Sunday, April 19th. And it goes through, printed it off, Wednesday, April 20, no, it goes through Thursday. Yeah, Thursday the 23rd. It's free, I believe, and you can look up what's going on. They have different programs and different presentations at the Willows.
Great, thank you for sharing. If no one has anything else now, we can move on to communicable disease update. So I have something that Maggie sent me for March, which I can cover now. It's not loading. Do you have anything, Babby, that while I load this?
I can go over from the county the week's activity update in terms of respiratory. So we know that all respiratory right now, including RSV, influenza A, and B is also down, and COVID are all on the very low in the county right now. Even RSV is going down. Continues to be a little bit higher for the infants, but not any more than normal and going down. So wastewater also verifies this. I would say what we're looking at more now are allergic rhinitis from allergies, very bad allergy season, and I would remind people to keep their windows closed if it's cool enough so that you don't have a lot of allergens coming into the house, keeping pillowcases clean and whatnot. Inexpensive ways to take care of allergies if you don't want to do the class 2 histamines like Claritin, Allegra, and Zyrtec, or Flonase, which are very helpful in allergy season, is just keep a bottle of nasal saline in your backpack or in your car to flush out the nasal passages for environmental particulates going up the nose. Splash the eyes a few times during the day with the eyes open to rinse any contacts or particulates that are getting into the eyes. We know asthma is up right now as well, so keeping an eye on that. Lyme's disease, a tick disease, it's been probably most hospitalizations, at least half are from tick-borne Lyme's disease, of course, and babesiosis, Lyme's disease more, both bacterial infections. And I would encourage people to protect themselves with clothing before they go out of the house. What is it? It's protect, check, and remove. So protect yourself by long sleeve shirts and pants when you're going out. If you're going to be outside in a wooded area, try to avoid long grass. Try to stay on paths because we are seeing the nymphs now for sure. And then checking the minute you come in the house for any ticks. People take ticks off of clothing all the time, but if you don't want to do that, you can throw your clothing in a hot dryer for 10 to 15 minutes to help kill ticks. Those are difficult to get rid of. Yeah. Check your animals for sure. Yeah, check your animals for sure. You can't throw your animal in the dryer. But yes, you can get a flea and tick comb, and you can talk to your veterinarian about different options for your animals.
Great. Thank you for sharing. So this is a link to a website that Maggie provided with me last month just on a respiratory virus found in PA. So I'm just going to read directly from the blog, and I can also provide the link for the minutes as well after. So, little known respiratory virus found in PA and what to know. A lesser known respiratory virus has been detected in Pennsylvania according to wastewater monitoring that identified human metapneumovirus in samples at 2 locations in the state. Data from Stanford University's wastewater scan program indicate that human metapneumovirus, also known as HMPV, is at the Chester DeChlora treatment plant in Delaware County, as well as the University Park Water Reclamation Plant in Center County. Wastewater monitoring can reveal which viruses are circulating in communities by detecting genetic traces left in sewage from infected people. The Pennsylvania Department of Health lists human metapneumovirus as one of the respiratory illnesses that has been found in Pennsylvania, but specific data on cases is not available. The viruses can cause upper and lower respiratory illness, with symptoms including cough, fever, nasal congestion, and shortness of breath, according to the Centers for Disease Control and Prevention. The most recent data shows Chester and University Park processing higher rates in February and March than any point in 2025, though levels were nearly double the current rate in March 2023 and January 2024. This year have risen sharply since January 1st. Most cases are mild, but younger children, older adults, and people with weakened immune systems are especially vulnerable. Symptoms can sometimes progress to bronchitis or pneumonia, while people can contract HMPV year-round. The CDC says infections are more prevalent during winter and spring. It spreads through the air after some coughs or sneezes, through close personal contact or touching contaminated objects and surfaces, and then touching the mouth, nose, or eyes. HMPV was first identified in 2001 and now circulates globally according to the Mayo Clinic. There is currently no vaccine to prevent the virus. Health experts recommend basic precautions such as washing hands frequently, covering coughs and sneezes, and sanitizing frequently touched surfaces.
Nasal saline, once again, to flush out the nasal passages. And that is also coming down in the wastewater here.
Mm-hmm.
So we're not seeing it as much. I saw a lot of that.
Great, thank you. Any other communicable disease updates? No? Okay, great. Thank you. Now we can move on to the student intern program update.
So recently, just to remind everyone, my topic is sleep in adolescence, and especially the connection to that and academic performance. Most recently, I've been conducting interviews in the field of sleep in adolescence, including a pediatrician at Boston Children's Hospital and a professor of neurology at Harvard University. I've been using the information from these interviews and incorporating it into my other research and organizing all of this information more formally into a PowerPoint.
My topic is about family health history and cancer screening awareness. I've concluded my research with multiple professionals in the area, mainly from Nemours Children's Hospital, Jefferson, and Children's Hospital of Philadelphia. I've began compiling all my research from my interviews and other studies into a report that would detail how certain strategies to increase family health history awareness would play out in the community. Strategies include pre-made toolkits, awareness talks at local libraries, and other strategies, but kind of just compiling all the research. So.
Thank you both for your updates. Now we can move on to the chloride concentration and conductivity data of tap water presentation by the EAC. Does Ian need to pull up the presentation?
Hello, I'm Dan Burnham, Chair of the Environmental Advisory Council. And swell. Yeah, I would like to thank the board for inviting me to speak and share our council's work on this subject of tap water and stream contamination with road salt. Particularly thank you to Melissa Saffin and Dr. Acker for exchange of information and coordinating this. I just have a few slides because we've just started this work, but I think it's something that certainly for me has been very educational. So talking about tap water, just where do we get our tap water? And in our township. And that's rather a woolly subject because since 9/11, water companies are very hesitant to inform the public exactly where their water sources are. But from the internet, you can determine that it's a combination of both surface water, that is lake water, and also groundwater. For example, Aqua Pennsylvania, it's our utility. It draws water from local creeks, such as the Crum, the Pickering, and the Neshaminy Creek, as well as the Schuylkill and Delaware rivers, as well as groundwater from about 100 wells within or near our township. This shows the Pickering Creek watershed. You can see within the red line is basically the watershed for Pickering Creek. I should have brought my laser. And over on the right is the Aqua Pickering Creek Water Treatment Plant, which is right on Route 23, northwest of Valley Forge Park. And just south of it, you can see that dark space. That's the Pickering Creek Reservoir that captures all the runoff from this watershed and then empties into the Schuylkill River just north of it. So you can appreciate that there, even in this semi-rural suburban area enclosed by the red area, there's a lot of opportunities for road salt application and runoff into our streams and eventually into our groundwater. So these shows the tap water chloride concentration and conductivity by date collected for 8 residences, 8 members of the EAC, collecting tap water samples as early as February 5th up to the end of March. And on the left panel are samples from my house on North Bellevue Avenue, and then next to that is a member who lives on Chestnut Lane, and the next to that is Wooded Lane. And a neighbor who lives on Wooded Lane also got 2 samples from the fourth from the left, fourth from the right section. And then there were single collections at the remaining residences. You'll notice some of the chloride values are absent, and this was my learning curve with the Quantabs. When I was in the lab a few years ago, a chromatographic paper, you just needed to dip it in and then put it aside, and the water will seep up, but not with a Quantab. It's very thirsty. You got to keep it immersed in the water sample until the indicator turns black at the top. So after I learned that valuable lesson, the first week of March, I started getting valid chloride measurements. And you can see at my house, chloride concentration is around 100 milligrams per liter, and pretty much within that range for the other residences. I'll talk about the implications of that in a minute. So, tap water concentration collected by these 8 residences by date shows or suggests strongly, I think, that chloride concentration was falling during the month of March and may well have stabilized somewhat. I only have 2 data points to indicate that by the end of March. If you translate this chloride concentration to sodium chloride, assuming sodium matches chloride in concentration in your water sample, you get about a 200 milligram per liter down to 130 milligram per liter change in concentration over this 1 month period. Let's see. Looking at these changes in conductivity and chloride concentration, it's not unexpected given that at the end of February and end of January there were severe snowstorms, and between those 2 storms during the month of February there was intense cold and active road salt application. And then we encountered a thaw starting in early March. And this is reflected in the high chloride concentrations in the March samples relative to later samples collected after a period of warming when the meltwater may have lost some of its sodium chloride content as the road salt has been washed from the paved surfaces. So the results of this very preliminary analysis shows extensive road salt contamination of our township streams, groundwater, and tap water. Oh, wait a minute. How did I jump? I haven't showed you the... Yeah, I've got... Okay, here we go. I'm going to jump ahead. Also, this complemented with this was stream water collection, shown in the blue teardrops across Radnor Township. So you can see in the upper center is the Radnor High School, and going across the top, more or less right to left, is Route 30, and the major thoroughfare going north-south is the Blue Route. And so we collected a lot of samples near the high school and along Lancaster Pike, as well as down Ithan Creek as it flows south along the Blue Route. Those samples were also compared to ones in the lower left, which are from the Willows and Skunk Hollow, pretty much from Darby Creek. And we found that the chloride concentration variability pretty well matches that of conductivity. There is a very close relationship, as you would expect if chloride is one of the major anions. There would be a connection with ability to conduct electricity. There is some departure from a pure sodium chloride solution with the same milligram per liter chloride content, suggesting that, of course, there are additional conducting inorganic and organic substances in the stream sample. Comparing the data collected in October, the red bars, with data collected in March at the same time we were running our tap water samples, it's a clear indication that chloride concentration is increasing anywhere from 10 to 30%, going from October, which was 2 weeks after a dry spell, to March, which was during the period of warming after the snowstorms. And this, again, you would expect if there is meltwater emptying sodium chloride into the streams in March. In October, you're saying, well, why should there be sodium chloride elevation in October? Well, I learned that our aquifers are contaminated, our groundwater deep in the ground after decades of sodium chloride application is contaminated. And this is probably the case across the whole northern tier of states in this country. Our application of road salt has been increasing tremendously over the past 50 years, 60 years. And this is the consequence of it. You'll notice the good news in this sense is that contrasted to Brown's Run and Ithan Creek and Harding's Run, which are near Lancaster Pike or to the Blue Route, the streams over on the right side, like Fox's Run and Darby Creek, Abrams, Julep, Miles Run, Wigwam Camp, Skunk Hollow, they're a lot higher near Lancaster Avenue compared to those tributaries or of Darby Creek, which is in a more rural setting, far from major roads. In fact, we'd sampled some of those streams during the Great American Cookout or Campout last June, and found we had mayfly and caddisfly larvae in the stream in Skunk Hollow, which was quite gratifying because you couldn't find any anywhere else. The streams are sterile from just visual observation.
Dan, for really quickly going back to that slide, I just want to add that, just to remind everyone, the US EPA thresholds, right, are at 230 milligram per liter, just to level set. And so for March, we had 68% of our sites exceeded that level. The Canadian levels are much lower.
Yeah, I've got a slide to that.
You got that, okay. And then,
Yeah.
Go ahead.
but unfortunately, a good observation. So despite my learning how to measure chloride, I still had good conductivity information from February, as well as March and October. And here is the conductivity of samples collected over that period. And you see the expected increase in conductivity of the streams going from October to March. But lo and behold, there's even worse in February, which was a collection period closer to the beginning of the warming period, when perhaps you'd expect more road salt laden meltwater. So probably I'm going to be going out there bushwhacking again after a snowstorm next winter to drive home this point and get closer to a February-like time point and just show how high our chloride concentration can be. So there's extensive salt pollution in Radnor Township streams. It tends to worsen during a winter thaw when streams are expected to collect meltwater laden with road salt. In October, as Melissa was saying, 25% had chloride above the 230 milligram per liter limit recommended by the EPA based on their 1988 report. If you go down to March, 68% of sites had chloride above 230 milligram per liter. So you can see this is not only failing to sustain life in the stream, but is also from the tap water. Oh no, what did I just do? I hit the wrong button. Okay, good. Our tap water results. The salt contamination tends to worsen during a winter thaw, not only of streams, but also tap water. And tap water sodium chloride concentration is estimated to decrease from about 200 milligram per liter to 130 milligram per liter. This range, again, if you build an assumption on top of an assumption, translates to 79 to 51 milligram per liter sodium, which is in excess of the EPA recommended concentration of 20 milligrams per liter for persons on a very low sodium diet. So even perhaps later in winter, you're having clinically significant contamination of tap water with road salt. And the thought just occurred to me sitting here, we should look at bottled water as well. All of us drink bottled water. At least I don't, but maybe I should. So I'm going to suggest next winter, if I'm still on the board, is that we collect tap water samples as well as bottled water samples starting in October. We don't know what the lag is between collection and marketing of a bottled water. They may give the date of collection, I don't know. But it would still be important, I think, over a 6-month period to look at these values. PFAS, forever chemicals, are not removed or not at safe levels in bottled water because it's spring water. So the bottom line is, if you love tap water, you're going to have to find a way to remove it, at least at the point of source. And reverse osmosis is the most reasonable solution for several $100s. You can have a reverse osmosis set up in your kitchen. And there's some very good companies out there.
And I was just going to add also there's, Whole Foods that provides reverse osmosis water that you can go and obtain. So there's definitely options. At Whole Foods, they
What kind of
provide
water?
reverse osmosis
Oh, really?
water. Yep, that you can obtain. Yeah.
It's good to know. Remind us
I
for the
will.
next meeting, okay?
Sure. That's what my family does.
Thank you. Any other questions or recommendations from the board?
I mean, I think we were bringing this forward because we needed some medical expertise around some of potential implications or review of these levels of sodium in the water, knowing that we want to continue testing through next year, but understanding what type of research is out there or other studies that have gone on. I know you guys provided some initial thoughts on that, but I think this is really like human implication, and that's why we were bringing it to the Board of Health, because now it's no longer environmental only. So anything you guys can help us with would be great from your expertise, and then recommendations to the public on how to handle this.
No, I think it's great. Thank you for doing the work for
Yeah.
this and
Thank you.
taking the interest in it. I think it's a really important topic. I would love to see the trending on that. Has anybody else done studies on this?
Tap water, I don't know. I haven't looked at the literature. Certainly, and in fact, on the next slide, is the organization that really kick-started this whole effort, and that's Stroud Water Research, which is centered nearby, and it's collecting stream water samples across southeastern Pennsylvania, both in the baseline October-like period as well as after snow events. And I should ask them if they are analyzing tap water as well.
Yeah, it'd be interesting to see how that's trended out
Yeah.
through a time period. Also, I would like to see maybe a couple samples in the summer, maybe, because when we see people treating their yards with, pesticides or whatever, I don't know what kind of chloride's in that.
Right,
So how would that look like? What does that look like in our groundwater?
yeah,
And does that affect the summer months? We don't know.
yes.
This isn't public comment time, but
It's a really
I
good,
believe it's
thing to be
absurd.
looking at.
So, I mean, and that alarm
Who
just
are
told
you?
me. I'm Diana Pope. I live on Windermere. So something to keep in mind related to the water treatment is, remember Flint, Michigan, and lead poisoning? That was because there was a change in the source of water, and the new water source had a much higher level of salt. And the water treatment people were not familiar with it because they weren't used to contending with it. And the salt helped the lead leach from the pipes, causing lead poisoning. So why aren't we talking about the water treatment plant? Because
they should be doing this.
filters, bottled water, all those things cost money
Yes.
that not everybody has. So then it becomes a thing where if you have the money, then you get to be healthier. That's not okay. Anyway, that's my comment. Thank you.
I agree with that. I think the filtering should be taking a look at that. Unfortunately, there's so many things to filter out of water this day and age, from pharmaceuticals to hormones to when you urinate, goes into the plumbing, there's just so many things that, honestly, I think we do need to talk about that. We've used a system in our house for years. We've used a Berkey, actually, system with filters in it.
Reverse osmosis?
Yeah, well, it's a Berkey system. So Yeah, has the
Yep.
filters in it to
Yep.
take out smaller particulates, like
Yeah.
pharmaceuticals.
Yeah.
But it's $200 to do that, and we have to fill it all the time.
Now it's, for a nice system, it's $600.
Yeah, this is, yeah. I think it's a
But
problem.
it's worth
I think water's very important.
Yeah. Especially bottled water is no haven,
No,
Bottled
it's not a
water
great
has-
alternative, that's for
Right.
sure. No,
so.
We're seeing bottled water
its
has
own issues.
BPA and particulates that
Yeah.
way in it, and it's heat, they leave it out in the sun. And
Yeah, it's bad.
I did invite Aqua PA to speak to us over a year ago, and they came with their lawyer, so they expected a problem, and we didn't give them any problem. But they did talk about enhancing their water treatment, especially from Pickering Creek and our township, for removing PFAS to get it down below current level of 14, I think it was ppm for PFOS, down to the new EPA threshold of, I think, single-digit levels. So they're putting in activated carbon filtering system, and it won't handle the sodium problem, but I think it'll absorb a lot of other organic material that's poses a threat.
Yeah, so maybe.
Thank you.
Thank you,
Thank you,
Diane.
Thank
John,
you.
for
Thank you
doing
so
that.
much.
Thank you.
Will we be able to have this presentation provided to Marion to put in the minutes as
Yeah,
well?
sure, yeah, I
Okay,
think we can.
thank
Yeah,
you.
Dan can provide that.
Does anybody have any old business? Any? Nope, I don't think so. No one emailed me with any additions. So we can move on to new business and get the RTSD update.
Hi, good evening. Yes, we are, you were commenting earlier about the uptick of seasonal allergies. We have seen flu go down in all 5 of our buildings, which has been great. So our attendance continues to improve, which is great. It was a long winter, but the seasonal allergies has been an issue. 2 things that we have upcoming. May 14th, we have a parent informational night. We contract with the Karen Foundation. It's our drug and alcohol counseling service that we provide to our students, and they'll be hosting a parent informational night at Radnor High School. The topic is student athletes and drug and alcohol use, and just the implications of that. And then we're also going to be reviewing our PAYS survey results. Those are given to students in 6th, 8th, 10th, and 12th grade. This June, we're starting to look at that information from the previous survey. Students are surveyed around drug and alcohol use, mental health, and overall social emotional. So we evaluate that as a school district. We present out on those results and then come up with an action plan, which will start next year, to support our students K through 12th in all those areas.
That's great.
Thank you. Also, before you leave, I just want to make sure I get your number for the group chat, for the board's group chat.
Okay, great.
Thank you. Maggie, unfortunately, isn't here to give us our Board of Commissioners update. And I think Alex usually gives us our county update, but unfortunately, he's on Zoom and he can't speak at the moment. But he did talk about putting the new food pyramid as an item on the agenda. I don't know if anybody can speak to that. Oh, thank you.
I mean, it's basically flipped the food pyramid upside down, as probably it should have been all along, because now we're eating more like a Mediterranean diet, right? We're taking grains and cereals and breads, and potatoes are no longer the biggest suggested recommendation. It's the smallest. And we're looking at more protein, dairy, healthy fats, olive oils, coconut oils, avocado oils. Vegetables and fruits are at the highest, so at the widest part now of the pyramid. Basically, the pyramid is flipped upside down in many ways. So it's really much like a Mediterranean diet. Whole grains are at the smallest recommended allotments of food. So, and I think we understand that the way that the sugar index and whatnot works. I mean, we know that eating a diet of healthy fruits and vegetables And healthy fats is important. And keeping our carbohydrates and our complex carbohydrates low is important.
Thank you. Does anybody have anything else to add under new business at all?
I think the only thing I would, oh, go ahead. The only thing I would recommend is for people to always be keeping an eye out for FDA recalls, as we were talking about before. I just quickly looked in notes this morning, and I saw these are things you should check with your doctor for if you're on a thiazide. I think it's clonidine that was being recalled, only certain pharma lots. So something if that people are taking that, and I think it was the patch form only. And the other was a form of Xanax XR. I think it was 3 milligrams, and it was put out by Viatris Pharma. So if people are taking that, to check with their practitioners. We're always looking at this on a weekly basis of what's being recalled, and it's only in lot forms or different pharmaceutical houses.
And I was just going to add that I think as a topic, we would definitely want to open up potential applications, right, for additional Board of Health members for individuals that are interested. So we ensure we have a quorum at every meeting. We talked about that just now. And then as a potential topic for our students, and if we end up getting additional students, I was thinking that maybe something that would be of interest to the public is a topic around AI and adolescent mental health. I think, you know, we're all driving towards that topic around the world, and I think it's important to understand even just Radnor Townships, like the school requirements that have been put in place. Should we refresh those? Should we analyze what's going on with the new data sets around mental health and what our children are experiencing day to day with social media and cell phone use and ChatGPT and agentic agents? And I can go on and on about this subject, but I think it's something that we need to really refresh and take a new lens on. So I would take that as a topic.
For that, I think that's a great idea, first of all, but would you suggest, like, I mean, what just came to my mind when you were mentioning that was sort of like surveys with the students, because I mean,
love that.
Oftentimes
yeah.
I think, especially like student to student, it could be, you know, like a more honest conversation.
Yeah,
But
I love that.
maybe, would you suggest like having it in a presentation form, or?
I think eventually a presentation
Mhm.
form, but like as we're sending these surveys out is what I'm hearing right now about mental health, and we're going to get an output from that. I'm not sure if we're going to get a root cause on what's going on with the mental health of our students, right? I can probably say that, you know, the social media is probably going to take a dip there. But yeah, I think a survey, maybe eventually we get there. Understanding like our students' bandwidth right now to take that project on. Go ahead.
I can add to that, and they can speak to it, but this is the first year our high school has done the off and away. So there are no, you know, the cell phones are not, they're not permitted during the school day. And I mean, I know as an educator and who was a former teacher there, it has really changed the dynamic and just the feeling of the whole building. Our middle schools also has been implementing an off and away for a few years. So I think there's been a lot of benefits to the high school, and I've heard from
That's
multiple
amazing.
students.
Yeah.
It's helped them and just create that boundary within using their cell
Yeah.
phones.
Yeah, no, that's really helpful. Great. All right, that's it for me.
I know that our student interns are almost done their projects and plan to present in May or June's meeting. So I don't know if you have the bandwidth to take on that project or enough time to send out those surveys.
For the fall.
So we could send it out, to the new applicants in the fall. I think that would be a great project to offer to them. And then also something I'd like to add is that something I think at the last meeting, Maggie and I, we all discussed it at the end, but it wasn't on the meeting, is that we could find a way to get a liaison or not a board member or someone from Villanova, the university, from the health center as well, to come and serve on the board as well, not as an official member, but still come to the meetings And
Oh,
so
yeah, like as a consultant
Yeah,
of,
mhm.
yeah, that sounds really
that would be
great.
something
Yeah,
we can discuss too as well.
great.
Okay. If no one has anything to add, I think we already covered public participation. So a motion to adjourn?
Yay.
Second?
Adjourned.
Second.
Great. Thank you.